Hello there, welcome to the world of Assassinate where your academic needs are met. We don't come again, we'll look at another aspect of our lecture series on maternal and child health, EDD and GA. EDD means expected date of delivery and GA means gestational age. So, what are these two things about? These two things we talk about, okay? Then, first of all, as you see this woman now, she's thinking in her brain, oh, when she goes to the antenatal clinic, there are certain questions that must be asked, like, oh, where do you think you will deliver? That's the question that comes. That's the first question that will be asked. When was your last menstrual period? So when do you expect to deliver? So that's the question that will be asked. So how does this woman figure out these questions? How this woman will answer all these questions now? So moving on, the way to actually determine this is to understand the concept of expected date of delivery and the gestation. That's the gestational age. Please, very, very important. EDD and GA. So expected date of delivery and gestational age. So first of all, we'll look at EDD first. Expected date of delivery. So before we look at that, we have to understand the basics, which is the menstrual cycle. Every woman, every normal mother or woman, female, should experience the menstrual cycle. Menstrual cycle is a continuous cycle that controls the release of ovum or ova from the ovaries that helps in the process of reproduction. So this cycle now is very, very important because for every woman or female, the female must have an average number of days of this cycle, which is 28 days. Sometimes it could be less, sometimes it could be more. So please take note, but the average number of days is 28 days. So based on this cycle now, this first day, day one, is the date of interest here, because that's the first day of the first day of the last menstrual period. You understand? Because that's what we use as we move on to that determine the EDD and GA. You understand? That's what we need. So all these other parts are also important. That's to understand the whole concept of the menstrual cycle, like the proliferative phase, which is where the follicles will develop to later release the mature ovum. You understand? The egg. So that stage is the ovulation stage. Then there's also the after it has been released, what is left there is the corpus luteum, which is produces the progesterone that helps to maintain the structure of the uterus. Then when there's no fertilization, there will also that would then lead to menstruation. So very, very important. So at this point now, what to concern us now here and I say we need to know that first day. You understand? That's what we need for the next part of this lecture. Thank you very much. So next one is now to understand this EDD very well. I told you before, there's an important part that we need to know, you understand, which is the LMP, which is the last menstrual period. You understand? So, an important or common rule that can be used to determine EDD, expected date of delivery, is the Naegele Rule. You understand? Or Naegele's Rule. You understand? Provided you spell it well, that's what it involves. So, the formula here, according to the Naegele's Rule, it is EDD plus LMP plus 7 days minus 3 months plus 1 year. Very, very important. Please take note of this formula very well, because that's what we use subsequently. So the LMP there is the first day of the last menstrual period. You understand? Please, very, very important. And the EDD is what we are trying to determine here, which is the expected date of delivery. So next one is we'll look at an example. Assuming a lady comes to you as a nurse and tells you, okay, the last date of my that's in an antenatal clinic. The woman comes to you and says, the last time I saw the first day of my last menstrual period is January 10th of 2024. You understand? So, and the woman is about to determine the EDD, which is the expected date of delivery. It's very simple. This is a stepwise process that we can go about this to get the final answer. So, first of all, I told you now, you add 7 days to that day. If you add 7 days to that day to be January 17th. Then the next step is subtract 3 months from that day. If you subtract 3 months from that day, check a calendar, please. If you're trying to do this, make sure you have a calendar beside you to follow up this the whole explanation to make it clear. Then add 3 months. That's almost subtract 3 months. Sorry, you have October 17th. Do you understand? October 17th. Very, very important. That's obviously the previous year, so which is October 17th, 2023. Then from that year, you add 1 more year. That from that date, add 1 more year from that to that date. So if you add one more year from that date, it's simple. From October 17, 2023, adding 1 more year to that date, you have the same date of the following year. Simple. That's all. You understand? That's how it works. Very, very important. So the next part here you have what if you don't have a month that has complete enough days? How do you go about it? Still simple. Same idea still follows. For example, we have the last menstrual period of November 28th of 2024. So, and the first step I told you now, same thing you do, add 7 days from that day. If you check a calendar, please, I told you, take a calendar to be watching this whole thing, to be checking this whole thing. I beg who calendar so you could understand what they talk. Then add 7 days from that day. So 30 days are September, April, June, and November. So November has 30 days. So if you add 2 days to that 28, you have 30. So every other day after that will be December. So 7 days from that 28 will give you December 5th. So the next step is subtract 3 months from that day. So to be that same date, September. So then on that date now, same thing you did before, add 1 year to that day. So that's it now. Same date, but the following year. That's all. That's the EDD. You understand? So very, very important. So next step now, this is clear. Thank you very much. The next step is, aside from this Naegele's rule of determining the EDD or a special date of delivery, there is the pregnancy wheel. We call it gestational wheel too. It's very simple. It's like a little device. You can even place it in your pocket. You understand? A very small device that can help you determine the exact. Instead of doing many calculations, not all of us can do calculations. Sometimes we don't feel calculate too much like that. All this plus, minus, and all those things. So this helps to give you an accurate date. So if you check now here, you see that that's where there's that's the first day of delivery, of last menstrual period. That's it here. You understand? So it rotates. You can rotate it. It can actually rotate. You understand? So very, very important. I'll put an image to like show you how it looks like in real life. You understand? You can easily rotate it. You understand? Around. It's a wheel. You can rotate it. So that's how it works. So that's the idea. And as from that day, you can see that if you calculate the due date is supposed to be the 40th week. That's the normal duration of gestation, which is 40 weeks. You understand? So anything beyond that, which is 42, it is post term. Then anything before that, it is preterm. So very, very important. If it's 37 weeks, it is preterm. If it's 42 weeks, it's post term. You understand? The normal date is 40 weeks of gestation. So that's how it works. You understand? So next one now is you see how it looks like. They can easily rotate. Can rotate the wheel. You understand? Very, very important. So at this point here, we'll look at the how to calculate for gestational age, GA. So it's very simple. This one is even the simplest. First of all, if your woman comes to you and say, no, so please, doctor, how do I calculate the current age of my pregnancy, or how many months I've progressed in this pregnancy? It's very simple. Just say, okay, see that same idea. What is your first day of your last? When you start to see your period last, that day we start, let me know. Then take note of that date. Then the current date too. That's what will determine how you calculate it. Simple. So at this point here, you see that very simple. If you're asking calculating for GA, example, if the LMP is January 10th, 2024, the today's date, for example, is April 3rd, 2024. Calculation simple. From that January 10th to that current date, you calculate it bit by bit. From January 10th to February 10th, 4 weeks, obviously, 1 month. On that one again, from that February 10th to March 10th, on that 4 weeks, 2 months. Then from that March to April 3rd, now it cannot be 1 month again. So because it's less than 1 month, it's supposed to be having April 10th, so but it's less than it. So simple. That's not a problem. So it means that from that date to this date, it is 3 weeks and 3 days. So total, add all the weeks together: 4 plus 4 plus 3, 11. Then the days remaining, put 3 days. That's all. That's the exact gestational age. You understand? If you want to put it in when documenting, they don't really put this in the reports. They usually put this like 11 no number 3/7. You understand? So they both mean the same thing. So this is a more in terms of documentation, this is what is used. So very, very important. The next part here is the quick formula now to determine how to calculate for gestational age. How do you go about this? Simple. Same idea too. You're using weeks. Know the current date, know the LMP. Then divide by 7. That's all. So if you know the LMP of today, if you determine it till today, if you determine it, you have calculate the number of days. You have 80 days. Simple. Just divide it by 7. Then you have 11 weeks with 3 days remainder. You understand? That's how it works here. So simply, this is a quick formula. Just simply calculate the number of days from that last menstrual period. Simple. Then divide it by 7 because it's usually measured in weeks. So that's it now, basically. So 4 week. How many days will make 1 week? 7 days make 1 week. So you're dividing by 7. That's all. Simple, easy peasy. So in case you have more questions, you can put it in your comments. That's it, basically. Then what if there's a woman that comes to meet you and does not know? I don't remember again. My nurse, my doctor. I don't remember when I tasted my last menstrual period or the first day of my last menstrual period. I don't remember those. I don't remember anything. I just know say I get belay. Okay, so that's a very simple problem. That's not an issue. You understand? Since you don't know that, those important facts, simple. You can use a different method now, which is the ultrasound. This provides more accuracy, determines the age of the size of the baby, and other important information too. If there's abnormality in the fetus, also it tells you that. Very, very essential. So at this juncture, we'll wrap it up and say, anytime you go to an antenatal clinic, make sure you try this out. Make sure you experiment this idea of how to calculate the EDD, expected date of delivery, and also the gestational age. This will help you a lot in your exams and in understanding your concept of pregnancy and maternal and child health. So thank you very much. Remain on it. In case you have questions, you have any opinion to air, make sure you put them in your comments. Don't forget to like, don't forget to follow or subscribe. Thank you very much. I appreciate it.